right. Good afternoon, everyone. Thank you all for being here, and thank you for your patience. We are gathered here today to talk about the city's progress implementing trauma-informed care practices, something that feels especially appropriate given the dark and violent week and years that we've had here in Baltimore. And this is about the way that Baltimore's American Rescue Plan Act investment will help sustain and deepen this great and important work. I am joined here today by Director Jackson of the Mayor's Office of Neighborhood Safety and Engagement, our Health Commissioner, Dr. Jaraza, Councilman Z. Cohen, who has been central to the work that we are talking about today, and a steadfast champion of trauma-informed care practices in Baltimore, Councilwoman Ramos, a member of the Trauma-Informed Care Task Force, Delegate Regina Boyce, who is also dedicated to this great work, and many of the great and wonderful a group of the members of the Trauma-Informed Care Task Force that I had the honor and privilege of swearing in February outside of City Hall. You can see these individuals who are doing great work in Baltimore as individuals, but also uniquely great work together collectively as the members of this board. This group of people has been hard at work since I swore them in, and very excited now to share the mic with them today so that we all of Baltimore can learn more about their work today and where it will go from here. Every single time we lose a resident in Baltimore to violence, I think of the impact that those horrific tragedies have had on our communities, on the friends, the loved ones, and neighbors of those who we lost. This is very deep and very real harm that impacts our residents, especially our young people, for the rest of their lives. This is not something that goes away for them when that shooting and that homicide is no longer on the nightly news or in a news clip. It is also important to recognize that we as city officials, as a city workforce, also carry our own trauma into the work that we do on a day-to-day basis. And that is to include myself and the other elected officials here today. That's why, upon taking office, my cabinet, senior staff, and I began our training with trauma-informed care practices, and it's why we are committing ourselves as a city government to operate in a new way that's more mindful of the trauma when we engage with our residents and with each other. This ties directly into my comprehensive violence prevention plans focused on shifting towards treating safety as the public health issue that it is. And you may remember a few months ago, we made a historic announcement of $50 million through ARPA focused on violence prevention. This investment will significantly increase our capacity to reduce the violence occurring on our streets and to activate community-based organizations as a part of our comprehensive violence prevention plan. One very, very important piece of that funding relates to why we are here today. We will spend $900,000 of ARPA money that will go towards healing City Baltimore. $510,000 will go towards something many residents have been asking for in Baltimore, and that's trauma-informed care training for our community members at large. And there are related investments that will help us be more responsive to community needs and build capacity of our community to address them. $750,000 towards mental health programming and $1.1 million in community grants for organizations that are carrying out this work at the grassroots level. For the members of the press, you heard me talk earlier today about how everyone in the community has to be a part of dealing with the violence and trauma in our city. The individuals that you see behind me, the organizations that they represent, are doing that work every day. They understand how we have to attack this disease of violence from every perspective and not just in a reactionary fashion, that we have to build and change people's minds and hearts in our culture and our city from the ground up. And as a reminder, you can find these grant opportunities on MONSE's website. That is monse.baltimorecity.gov, monse.baltimorecity.gov. I am thrilled to make these historic funding opportunities available to this effort and in partnership with the members of our community in Baltimore. As you know, curing Baltimore violence is my top priority as mayor, and the dollars we invest today in this vision based in equity, healing, public health, and trauma-informed practices will build safer neighborhoods today while paying dividends for our neighborhoods in the future. I'll now turn it over to Councilman Z. Cohen to talk about the work of the Trauma-Informed Care Task Force and the Healing City Movement. Councilman?
So let me begin by thanking Mayor Scott for his unflinching belief in this work. It's one thing to say at a press conference or put in a plan that you believe in something. It is wholly another to invest dollars and resources into its implementation. And that is exactly what the mayor has done today. And so I want to thank Mayor Scott for his leadership on this important issue. I also want to thank some of our excellent partners in city government, Dr. Letitia Jaraza and Director Heidi Daniels of the Health Department and the Enoch Pratt Library System, respectively, who have been working hand in hand to implement the first round of trainings in our libraries, and that has been an incredible partnership. And finally, I also want to thank my friend and our partner in this work, Director Shantae Jackson, who is bringing communities together in a way that Baltimore has not seen under the leadership of Mayor Scott to really confront, but also to co-produce public safety in our city. And so I want to directly thank Shantae Jackson for her excellent efforts in this work. Also want to thank and appreciate my colleague, Councilmember Odette Ramos, whose deep understanding of housing policy and commitment to equity has helped shape the work of this task force, as well as our dear friend and fighter for justice out there in Annapolis, Regina Boyce. Delegate Boyce, thank you for being with us today. But today is about acknowledging a different way of doing business. Our theory behind the Trauma-Informed Care Task Force is if we want to be better, we need to work together. We need to break down the silos between government, nonprofits, medical institutions, and community. We need to center the voices of people who have experienced the most trauma in finding the best solutions. We need everyone, from returning citizens to physicians, to clinicians, to students and parents, to have a seat at the table, and that table must look like Baltimore. I'm so proud of the 38 people who have given their time, talent, and energy to help to begin to eviscerate trauma from our city. And in Baltimore, we all know what trauma feels like. We felt it when Officer Holly was cruelly ambushed while sitting in her car, and our prayers are with her right now. We felt it when Evelyn Players was stabbed to death in her church. We felt it when a 13-year-old child, Malia Turner, was shot and killed outside of a rec center in Sandtown. We felt it when Carlos Ortega and Javier Cato were killed in a barbershop while getting their hair cut. Churches, rec centers, barber shops, these should be safe spaces, safe and sacred spaces. We feel it every day when we lose neighbors, friends, and family to overdose deaths and COVID-19. We know what that pain feels like. But we also know what it means to be resilient. Our city has grit and heart and hustle and chutzpah and compassion and creativity. Baltimoreans are brilliant, and this task force is a testament to our capacity to build together. Our city's salvation will not come from Philadelphia or New York or some other city. As Mayor Scott very aptly said, no one is coming to save us. Our healing will come from us. from those who stubbornly refuse to give up or put our heads down amidst the grief. Today, you'll hear about 5 subcommittees of the Trauma-Informed Care Task Force. You'll hear from our medical subcommittee about a unique partnership with Bishop Bruce Lewandowski, Kathleen Page, BUILD, and the primarily Latino congregants of Sacred Heart Church to improve health and mental health outcomes for a community that has been largely locked out of health care in our city and country. You'll hear about our support for and partnership with Mayor Scott's 911 diversion program, because we believe that police should focus their efforts on arresting people that commit violent crimes, not people who are suffering from schizophrenia or other forms of mental illness. You'll hear our youth group talk about their work to reimagine rec centers as safe spaces for kids and the partnership we are building with the 3 schools of social work, Maryland, Coppin, and Morgan State. You'll hear about the training we're doing in trauma-informed care, restorative practices, mindfulness, and so much more inside and outside of city government. And you'll hear from our Decolonizing subcommittee about the need to center solutions from communities of color who have experienced oppression and high rates of trauma. It is now my great honor to introduce from our policy committee, Nika Namdi from Fight Blight Be More.
Happy Friday, y'all. I'm Nika Namdi. I'm the co-chair of the policy subcommittee of the Trauma-Informed Care Task Force. We know that apartheid and trauma in Baltimore have caused in large part by failed local, state, and federal policies of the past. If we want different outcomes, we have to take different approaches. This committee will recommend policies that disrupt cycles of trauma, while introducing new policies that stabilize, repair, and heal our most impacted residents and communities. We have started with a partnership with the Mayor's Office to expand diversion program for 911 calls when someone is experiencing an acute mental health crisis. We support Mayor Scott's vision to remove mental health issues from the criminal justice system. Police capacity should be freed up to focus on addressing crime, not schizophrenia, not addiction, not homelessness. For too long, the city of Baltimore has attempted to use incarceration to address mental health issues. This is why we will help to build an alternative model for responding to mental health crises. We are also working on a bill sponsored by Councilperson Ramos to identify racist policies and create equitable replacements. The committee will also be holding listening sessions to hear from residents how they experience trauma caused by city policies. As the birthplace of restrictive covenants and America's first city to enact laws that segregated communities by race, we have an obligation to confront race-based trauma head on. We can build affordable housing, we can eliminate blight, and create communities that are safe, thriving, and vibrant. But this will take a serious uplift of policy on the local, state, and federal level. But we're up to the challenge.
Thank you so much, Nika. We will now hear from Tika Torres from our medical subcommittee.
Thank you. Thank you. Hello, my name is Tika Torres. I use he, him pronouns, and I'm one of the members of the medical subcommittee. With the support of this task force, Baltimore has an opportunity to lead the nation in rebuilding trust between medical institutions and underserved communities. We seek to address the profound impact that trauma has had on the health and well-being of our community. Over time, medical racism, unjust practices, and cultural insensitivity have created distrust between medical institutions and the community members they serve. Our subcommittee will support the rebuilding and strengthening of these important relationships. We will do this by uplifting trusted community organizations already doing healing work in Baltimore and connecting them to healthcare professionals. We also aim to provide trauma-informed care training to our healthcare institutions. We have begun to implement these objectives at the Sacred Heart of Jesus Church in Highlandtown, a congregation that primarily serves as a Hispanic Latino population. We know that this community experiences a disproportionate amount of trauma, yet often has severely limited access to health care. We are building off a collaboration between Bishop Bruce Lewandowski of Sacred Heart, Dr. Kathleen Page from Johns Hopkins, BUILD, Medicine for the Greater Good, the Esperanza Center, Baltimore Core, and Centro Sol to bring physical and mental health services inside the walls of that church. This partnership helps parishioners become trauma-informed healthcare navigators and provides the community with access to affordable, culturally appropriate, bilingual health services. We also expect to expand a therapy program that treats depression among Latinos. Our collaboration invites our partners to hold us, healthcare professionals, and this task force accountable to advancing trauma-informed approach with a specific emphasis on voice and choice, mutuality, and empowerment. It is an honor for us to be invited into these spaces, and we look forward to creating a model that can be replicated across the city, state, and nation. Thank you.
Thank you so much, Tika. And we will now hear from our training subcommittee with Desiree Dixon.
Good afternoon, everyone. My name is Desiree Dixon, and I'm the co-chair of the Training and Evaluation Committee. Our call to action is to address the systems of oppression that continue to harm city residents, especially people of color. Systemic oppression isn't just about police brutality. It's about a stressful trip to the MVA, or frustrating calls to 311, or avoiding going to the doctor except for emergencies because you're afraid of being misdiagnosed, or worse. It's also about constantly dealing with the belief that some of us deserve less because we are less. Our first goal is to address these daily encounters by training every single member of the Baltimore City government to not just be tolerant of the citizens they serve, but to treat each of us with empathy and respect. We're teaching city agency employees how to heal trauma when they see it, in libraries, rec centers, and on our streets. This intensive year-long agency training has started with the Enoch Pratt Library System and is led by the Health Department, Sage Wellness Group, Open Society Institute, and Councilmember Cohen. We're teaching mindfulness, restorative practices, the brain science of trauma, self-care, and so much more. To heal our city, it's not just enough to change how government operates. We also have to reach into our communities. And so our second goal is to train neighborhood and community-based organizations. We'll provide trauma-informed tools for working with city residents. Our community agencies have so many gifts that we seek to tap into, like their resiliency and joy in the face of so much adversity. Empathy is key. We need to look out for each other. We are one Baltimore. Every trainer that we bring in is Baltimore-based. We cannot import healing from New York or DC. We Baltimoreans are the medicine. But this is a process, and it will take time. But it starts with each of us. And our committee's role is to empower us. We can do this. Thank you.
Thank you so much, Desiree. We'll now hear from our youth committee and Lydell Hills.
All right, so good evening. My name is Lydell Hills. I'm the co-chair of the youth committee on the Trauma Informed Care Task Force. And today, we all are here today because we already know, and we are here to be able to serve the different issues that are impacting the youth and the children in our city. For Baltimore to be able to heal, we must create spaces where our young people can imagine their futures and be able to live out those futures. Our work is to dismantle the systems that create and perpetuate trauma in Baltimore City and create opportunities for our young people to become thriving adults. We are doing this by transitioning rec centers into healing spaces. We are working to expand youth professional development opportunities, and we're working to end youth homelessness. And we recognize that the healing of the future will be led by the youth of today. And in order to accomplish this, we have initiated a partnership with Coppin, Morgan, and University of Maryland to be able to create a pipeline. And so we're working with these universities to be able to create a pipeline of social workers who are culturally grounded and remain in Baltimore City to be able to lead the effort of healing our city. And the schools will develop a curriculum in partnership that explores the roots of trauma in Baltimore City and brings about community-based healing. We believe that this partnership has the power to be a model for university collaboration across our country, and we hope and we thank all of the community partners that will be able to help lead us in this effort, as well as the legislators and elected officials who will be able to help make this possible. Thank you.
Up until today, I did not know that Lydell was taller than me, so that's not cool, but okay. Keeping it moving. Our final group today is our Decolonizing Subcommittee. Please welcome Monica Guerrero Vasquez.
This is tall. Good afternoon, everyone. Buenas tardes. My name is Monica Guerrero Vasquez, and I'm the proud co-chair of the Decolonizing Subcommittee. I am proud to be here in front of you today to share that our work has been focused in addressing the impact of generational trauma in our communities of color, LGBTQ, immigrants, Native American communities, persons with disabilities, and non-Christian communities in our city. Our city has been the birthplace of racist policies, and we still feel the impact today. Too often throughout our history, solutions have been heteronormative and European-centered strategies to problem solving. We want to change that. We must adopt approaches developed and implemented by our community, by our people in Baltimore, those who have experienced oppression themselves. We seek to decolonize Baltimore's approach to healing. In that regard, we recognize that decolonizing is not an overnight process. It's a long-term goal that requires long-term solutions. The committee proposes an observatory to implement and evaluate decolonizing processes, while providing guidance on how to execute strategy to support and protect Black, Brown, Indigenous people's full humanity and agency. We will work with city agencies, nonprofit organizations, medical institutions to make sure that they operate in a way that honors the humanity of the people they serve. In that regard, Centro Sol has been piloting a successful culturally appropriate treatment intervention to address mental health stigma and depression among uninsured and uninsurable Latinos in Baltimore, meeting their needs through collaboration and without imposing beliefs. We believe this work is critical to rebuild Baltimore from the ground up. Thank you.
Thank you all. And I think what you heard today and saw today with this dedicated group of people is folks who, one, know and love their city in a deep way, two, understand that we all have to be better and that we all have to press everyone that cares about Baltimore, including me, to be better every day. And when we do that in love for each other and for our city and our community. And this, you've heard multiple times today, we are the solution to our problems, even though they are problems that we did not create and that they are older than all of us combined standing here today. but that we have the responsibility now to work to not pass them on to the generations that follow us. These folks are committed to implementing this trauma-informed care at every level, every agency, partner, and community organization for their role in this effort. And with that, we will take a few questions. Oh, sorry, you got to go over here so they can hear you on the video. Sorry about that, Lowell.
Mayor, you had mentioned the police-involved shooting that we had, and literally a couple of hours before this meeting started, 7 people were shot in 2 different neighborhoods in the city. Can you talk about how important this program is with this recent spike in violence, and maybe give, I don't know if anyone else could give an example of when a traumatic situation happens in a neighborhood, what happens right after that the investigation and the stuff has settled in that neighborhood? I was just curious. Thank you.
Yeah, Lowell, 2 things. One is more about what's going to happen as we evolve as a city. But first and foremost, we pray for those involved and the victims of those shootings. But we know that as a high trauma situation, and I think, and I appreciate your question and the way that you asked it in a way that is very sensible, but also in a way that's understanding of what that community is going through. You're talking about families and community members, that this, with the amount of people that were harmed in those incidents, and one of them I actually had to go through on my way down to City Hall for one of the visits down today. You're talking about dozens, probably hundreds of people impacted that know those individuals. And then think about the thousands that live in those communities that are impacted. And that's how we have to start to think about these. And chances are those who were the victims, those who did it, they themselves were at some point traumatized by violence in our city. That's why you hear me talk about it as a disease, and that we can no longer think that this is something that we're just going to press one button and it's going to go away. No, you don't do that. You can't root out cancer by treating one symptom. And what we have to do, and what we're going to be, and I'll let Director Jackson talk about that, what we're going to be doing and working with these folks to do is make sure that we now go when something like this happens, and we're going to clearly be working to make sure that less and less people are experiencing this. But as we know that there are people who just aren't in the place where we want them to be, that they can resolve their conflicts in a different way, and they are not in the right mental space, because we have to be honest and open about that. No one who is in their right or full function in mind is going out here to shoot someone, right? That means that we have a lot of work to do, and we're going to be going in community to help the community heal, and because we have to also remember that that itself can prevent more violence from happening, because it's oftentimes, as you know from your work over the years, that it's the family, the friends, the community of those people that love that individual that now perpetuate violence on another community, another family. Director?
Thank you, Mayor. Thank you for your question. In Baltimore City, we understand that we've got to balance reactive responses with proactive responses. What you've heard from my colleagues here today is what we're going to be doing to address trauma proactively and reactively. We want to make sure that there's a good blending there. In the Mayor's Violence Prevention Plan, we speak very clearly about a coordinated neighborhood stabilization response. That response is going to be piloting very soon and is going to focus on 4 types of traumatic events in our city. It's going to involve the mobilization of agencies, of community-based partners, of mental health clinicians, of the assets that we know that Baltimore has in a given neighborhood. And it's not just going to be a pop-up for 30 minutes or an hour. We're talking about 30 to 45 days of continual presence in neighborhoods where we're using data like 211 data, 311 data, 911 data, so that we can understand the social service needs, the city service needs, and the emergency service needs in a specific neighborhood as we roll out what those assets look like. The 4 types of events that we're piloting right now are events that involve multiple victims of a shooting in a singular event. where we see a young person under the age of 18 be a victim of a shooting or a homicide, where we see a police-involved shooting, because we know that that causes trauma in our neighborhoods as well, and where we see a major law enforcement takedown. And that's because we know that that creates power vacuums in our neighborhoods that can erupt into war.
Anybody else? Thank you.